to the WHO, which stands for the World Health Organization, the Zika virus is responsible for an international public health emergency. The virus has been linked to the devastating birth defects known as microcephaly, which means a person is born with a smaller than normal size head. What is the Zika virus? The Zika virus is a disease transmitted by mosquitoes. It is usually spread by mosquito bite. The person bitten by the infected mosquito may have symptoms, but strangely enough, that person can be bitten by another mosquito not infected by the virus and can transmit the Zika virus to that particular mosquito. The virus causes people, when infected, to have mild flu-like symptoms. These symptoms range from a mild fever, muscle, joint, and pain, skin rash, conjunctivitis, and headaches. They usually only last up to a week or so and are not severe. Sexually transmission is also a means of passing the virus from person to person. It is especially important for condoms to be used if a person or their partner has been exposed to mosquitoes in areas of the country that have reported outbreaks, such as Africa, Asia, Brazil, America, and the Pacific. That's why it's important when you travel to a country and you return that you seek immediate medical attention. Women who are pregnant are highly vulnerable to the Zika virus because of its tendency to cause microcephaly, an abnormally small head and brain. Delayed growth and mental retardation are also usually seen in children with this condition. Treatment is simple. Those who develop symptoms should treat the pain and fever with mild analgesics. Plenty of rest and drinking lots of fluid are also essential. Currently, there is no vaccine for the Zika virus. Prevention is geared toward reducing the breeding grounds for mosquitoes. Stagnant water should be avoided if possible. People should wear insect repellent or proper attire to protect themselves from bites. Commercial spraying of insecticides is recommended for areas highly populated with mosquitoes, and screens on windows and doors are highly advisable. Also, traveling to countries infected with the virus should be avoided if possible. The Zika virus is obviously a healthcare concern for everyone, especially pregnant women and women of childbearing age. Since there is no vaccine available, we must be diligent in preventing the spread of this potential devastating virus. We must take all precautions to reduce the number of outbreaks, not only in countries widely affected by the virus, but also here in the United States. Traveling to countries affected by the Zika virus should be out of the question. Unnecessary exposure can